everyone. We are just about to start our 87th Texas Legislature Policy Symposium. So just give us a second. We'll wait for people to get on. It looks like we are on Facebook Live. So I'm going to go ahead and let Chris Macy, our Exec Director, welcome everybody. And here's Chris now.
Well, welcome everybody. Let me spotlight myself. Yay. I'm hearing noise over here. Let me turn this off because it looks like we are online. All right. I just wanted to basically welcome everybody. You know, this is a new thing for us, having to do this online, where we would love to be in person with y'all. I hope that everyone that was able to attend our trainings is here and can hear about some of the bills that we talked about, or at least alluded to in some of the after hour discussions. Our goal really is for us to talk about some of these issues and bills that'll be at least priorities or stuff that we work on during the 87th legislature. And I want to let all of you know, this is just a small part. We're going to go through pretty quick. We're going to talk about each of these bills not in great detail. And some of these issues don't have bills yet. They either haven't been filed, or they're in the process, or they're a hopeful dream. Some of these issues may happen next session because of the way timing works and COVID and other stuff. But I want to thank all of our partners who are out there. And I don't think any of these bills will pass or could pass if we didn't have good folks in our corner working with us. Some of these bills have been written by our partners, people like Disability Rights Texas, the Coalition of Texans with Disabilities, Easter Seals, social workers, you name it. All the groups that Texans Care for Children, all these groups work together. And if we don't, we won't pass bills. So I want to thank the partners for being out there. And I want all of you to know is we've got tons of time. We'll stay here as long as necessary to answer questions. But if you please could hold your questions or type them in the chat. And if you type them in the chat, then we're going to collect those and go through them at the end. If you have other bills you're interested in or questions about them, that's appropriate time to do that too. We want to make sure that we at least get this to you, the information that are some of our major priorities. And that's that. I don't know what to say. I mean, we started this week in the 87th legislature of 2021, and it started midday on Tuesday, and we adjourned today. The hardworking legislators are giving themselves a 10-day break. So instead of having this kind of race to the end, we've got a break all at the very beginning, and that's disconcerting. But of course, not to be facetious about that, it's about safety. It's about safety, personal safety at the Capitol. It's about safety from COVID. There are good reasons, and I hope that this initial break period will give us time, everyone, to catch up for the bills to come through Leg Council, and for us to understand what the session is going to be like. As of today, my plan was to tell everyone about how we were going to be providing public input. That's a question we've talked about during our training sessions, during our staff meetings. We talk about this all the time. What are we going to be able to do to influence these decision makers? And I wished I had a better answer for you. A little disappointing, but I'll give you a very brief overview. As expected, the Senate is not that interested in us providing public input. I'm not exactly sure how we're going to do that. They are basically, through a series of restrictions or expectations of people being tested, as well as being in the building to do that testimony. They're going to leave a lot of us out who are not going to step into the building in order to provide testimony. It's a shame, but that's something they've decided. They also decided on temporary rules, 60 days worth of temporary rules. So things may change. In the House today, they debated the same kinds of issues, and there certainly is a plan to allow public input in invited testimony, which would be over Zoom or some kind of utility. I don't know if it will be Zoom, might be Teams, but Zoom seems to be the preferred one. They also talked about being able to register and put in your support for a bill as well as your testimony or your one-pagers through some kind of portal. No one knows what that means other than the name. And they also talked about being open and wanting public testimony, but the rules to do that are up to the House administration and each individual chair. So if you have a chair who doesn't care too much about public testimony, I don't reckon it's going to happen. So as much as I hoped that we would tell y'all some concrete things about how we can be the most effective in advocating for these bills, we still can't do that right now. At the end of the presentation, we're going to show you how you can learn about some of these bills online and how we're going to interact with y'all. And so please stick around for that. It should be in your PowerPoint. Everyone should have the PowerPoint, and you can follow along with us. We're again gonna it's the tip of the iceberg, and welcome to the 87th legislative session. It's going to be a doozy. Everything's going to be different this time. So I'm going to turn it over to Jackie, and she's going to talk a little bit about AST and what we do.
Thanks, Chris. I'm going to share my screen for a second. Here, let me make this full screen. No, there we go. So many of you know, you're probably familiar with Autism Society because you found this presentation, so we're glad about that. I'm Jackie Benestante, and I'm just going to walk you guys through, for those of you who are new to Autism Society or maybe not familiar with what we're doing. We did want to just give a little overview. First of all, we're celebrating our 31st year, and we've been around in first Austin, then in Central Texas, and then now we've been statewide since 2017. And if you check our earlier Facebook posts, you'll see we've actually started a lot of regional Facebook groups and support groups, and we're really, really expanding pretty rapidly right now. So we would love for you to get involved and check that. Our 4 core services are education, advocacy, recreation, and support. And education, we do things like this. We do all kinds of events. Oh, you know what? I think we've got Jordan pinned right now. How did we do that? I don't know. That's okay. Well, if you can see Jordan, that's totally fine. I'll see if I can I'm going to make myself the spotlight. There we go. Now I hope you can all see me. And if not, you can just wave at Jordan. But anyway, we do education events, and we do ones for autistic adults. We do ones for parents and caregivers. A lot of them are online, and especially since COVID, they've all been online. But it's also a great way for everyone to have be able to view them wherever you are. Our advocacy work, we're involved with Autism Society of America on their public policy committee. Here at the state level, we do all kinds of advocacy work for autistic adults, children, and their families, and it's really encompasses all issues. If you look at our position statements under our advocacy section, there's really not an issue that impacts people with autism or their families and caregivers that we're not going to at least be supportive of, or at least, in working on that bill a little bit. Recreation, we have some support groups that are rec events. We have an all girls group. We have Dungeons and Dragons online for autistic adults. We have support and recreation groups for autistic adults. In the summer, we did online gaming groups for teens and kids. So we kind of have a variety of those things. And then we have free online and in-person support groups. And we also have a social worker on staff and an information and referral specialist. And so if you have any autism related need, we're really here, and it's all, at our website, and our link is down there. I'm going to stop sharing my screen now. And then Chris is going to actually kick us off with the budget. So I'm going to cancel my spotlight video and make Chris the spotlight. There we go. And then Chris is going to tell us about the budget. Chris, you're on mute, I think.
Can you hear me now?
Yes.
All right. We're trying a different thing with spotlighting and switching off when we're speaking, instead of y'all being bored to death just listening to me talk. We're going to have some of these issue experts talk about the different issues. But I want to talk about the budget, and a wise advocate once said, if you're not advocating and being involved with the budget, then you're not really involved with session. There's going to be times and places where we're going to have bills that require a certain amount of money, and the legislator is going to ask, did you is this paid for in the budget? And you're going to have to say yes or no. And if you said no, well, maybe your program or whatever you're interested in doesn't make it through. And so we're going to talk about the budget, at least to start off with, in generic terms. The first thing we're going to hear from everyone, is that we're broke. Texas is broke, right? COVID has made us broke. Well, that was true, and it still is, unless you call broke having $11 billion in the bank. It's not really true, and we certainly have to have some of that money for cash flow and for a credit rating. But the rainy day fund, or the ESF, this pot of money that is supposed to make our budget work and supposed to help everybody, well, it's there. So we're going to hear that we don't have any money, we're broke. And then the comptroller came out this week and gave us a budget estimate. And instead of being $4.5 billion in debt, or not raising enough money, it's only about $800 million or $1 billion. Let's just round it, since I can barely add. And we have a supplemental budget, and that supplemental budget is going to be, $4.5 to $5 billion that could be paid for with this rainy day fund, this emergency fund. Either way, $6 billion out of 11, even if they don't pay it all the way down, we are not in the difficult budget situation that the legislature is going to talk about. Even when we have a lot of money, the legislature talks about a lean budget. They give money back. And so, at least at this point in time, yes, it will be difficult, but is it catastrophic? And I would suggest it's not catastrophic. If it was, we would see things like expanding Medicaid and medicinal marijuana, or racing, all these different things, gambling, ways to raise money. We would be hearing more about that, and we're not going to in the future from the general legislature, because it's not as bad as it seems. So when we look at those funds and we talk about those funds for autism and for disability issues, what it means is that even in those years that have been in the past very difficult budget years, we've been able to hold the line. We've been able to maintain the budgets that we have for supports and services. And I've been very pleased in the past that we've been able to make the case for continuing those things. Now, we're going to have to make that case for those even more. It's going to be a tough one, but I really feel like that we have an opportunity to talk about the budget in a way that makes legislators understand that the things we are really interested in are not difficult. They're just basic services have been paid for. So our main goal, and back to the slides, number 3, is to maintain these expenditures, right? We don't want to cut services. Again, Economic Stabilization Fund, we got money. It's important that we talk about that. And one of the things I want to, and we'll delve into it a little bit more, is that we need to have and hold the line on our education funding. We need to hold the line on our health and human services funding. We also need to figure out ways that compensatory education for our kids, that there's a budget item in there. Now, we're going to talk about a bill for that, but if that bill doesn't have a budget item, then we're going to be in trouble. For some of y'all, it's waiver slots. We always try to get community service supports waivers slots. The question is, how many can we add on? The main thing is just not to lose any, right? There's going to be lots of other funding streams for different kinds of services supports. And so we need to be active. We need to be available to work on the budget. And as we've talked about in the training sessions, the budget starts now. We have to be working on these issues the whole entire time. So our next thing we're going to talk about is the Autism Medicaid benefit. I'm going to turn that over to Jackie.
Okay, I canceled on the spotlight on you. I think I got it.
Now you got the spotlight
myself.
All
okay.
Right. Your turn, Jackie.
I'm on it. Okay, everybody. So I'm going to just talk about probably something that a lot of you are impacted by and have worked on because it's been going on for a long time, but that is the Autism Medicaid benefit. And that's funded by Rider 32. And as many of you know, a lot of us here at Autism Society either have our own kiddos with autism or kids with disabilities. And so we get it and we know, we understand the need for this. And one thing that, as many of you know, this did pass last legislative session, but we are still waiting for it to be implemented. So it's been close to 2 years. There's been a lot of delays. And I think, we're hearing it may be funded, but what we're really needing in this session is to have Rider 32 maintained and funded, in a way that is going to provide ABA therapy to lots of kids on Medicaid. It's those up to age 20 who have Medicaid with an autism diagnosis may be eligible for this. And it also has to be funded in a way with reasonable rates that providers can actually afford to provide ABA therapy to those with Medicaid. And it's, so it has to be kind of a sustainable and reasonable budget. And that would be in Rider 32. And so we're strongly going to be advocating for that funding. The other thing that is really important is the Children's Autism Program, the HHSC program that has been around for quite a while, and that is funded by Rider 86 in the budget. And this program, even when Medicaid comes online, when we hope ABA coverage finally happens and comes online, this program still kind of helps people that are kind of in that gap where maybe your private insurance doesn't cover ABA or whatever your plan is. Or maybe you don't qualify for Medicaid. And so we still are really going to push to continue the Children's Autism Program because it definitely, meets a critical need. And then the last thing, Rider 86 also funds the Texas Autism Research and Resource Center. So some of you guys are familiar with that, but they used to have an annual autism conference that was really good. And they also have a really comprehensive website with information. And so we'd like to see that funding continue as well. And now I'm going to unspotlight myself, and Tanya is going to tell us about the needs of early childhood intervention in the budget. And Tanya, I'm going to unmute your, I'm going to put you in spotlight and then.
Hi, everybody. My name is Tanya Lavelle. I am the External Affairs Director for the Autism Society of Texas. And I'm going to briefly touch on ECI in the budget. So early childhood intervention is something that, it's a program that's very near and dear to the hearts of families with children who have autism, who are impacted by autism. It serves, services that are provided to young children ages 3 and older. And it really is not just for kind of intensive therapies to help, children sort of, catch up with their speech and things like that, but it really is a school preparation program as well. So ECI is obviously something that's always in the budget, but unfortunately, more often than not, recently, it's been kind of a source of chagrin for advocates because oftentimes it's underfunded. So in this year's budget, unfortunately, is no different. One of the big issues that actually has come up with the budget and ECI for this session in particular is a response, or actually kind of a lack thereof, a response to the Department of Education's Office of Special Education and Rehab Services, or OSEP, Corrective Action Plan. So what happened there was that back in the summer of 2019, OSEP made site visits to Texas to kind of look into the ECI program and how it was being provided here, and were none too pleased with what they found. They found evidence of systemic noncompliance with IDEA Part C, which is where ECI lives. And they had some major concerns about disruptions in providing services because of what they saw the root cause was underfunding. So they wrote a letter to HHSC. It came out late last year, toward the end of last year. But unfortunately, it doesn't look like anything has been done in the budget to address those concerns. And unfortunately, when you underfund ECI, you end up not just being able to provide all the children who qualify for ECI with services, which is the primary component of IDEA Part C, but unfortunately, you also make it so difficult for providers to actually provide these services that they end up shutting down. And that was something OSEP mentioned also, is that they have, the state has giant gaps in actual providers in the state. So if a provider closes, which happened a lot, and has happened a lot over the past 8 to 10 years, the state never really did much to sort of close the gap. So there was a big problem with actually providing children the services they needed because there were not enough providers in the system. So that is the major thing with ECI in the budget. And, generally, of course, with that, HHSC can fix it by adding more money. And we need to add GR, general revenue, into the program. We get a lot of federal matching dollars, but those really do depend on how much money the state itself decides to put in. All right, so excuse me, I'm going to move on to slide. Let me double check which one this is. Let's see, this is slide number 7. So I'm going to keep kind of going a little bit more into ECI since I already started on it in the budget. So as I mentioned, ECI is consistently underfunded every session. This is something that started back in 2011. There was a major budget shortfall, and the majority of components of the Texas budget were slashed considerably. Unfortunately, ECI has never really recovered from that. And just because of the fact that Texas population is consistently growing rapidly, really the program needs to be funded at a level that will allow for that increase. So you can't keep, providing services at, let's say, the number you need for 2021 is going to look a lot different than the number you needed in 2019 because you've got more kids who qualify. And that's really just, a symptom of Texas's booming population. So it's really important to consistently up that funding to make it acceptable for, to really provide the services that we need for our kids. So advocating for extra funding for ECI, and by extra, I mean adequate funding for ECI, is something that advocates constantly do. And so beyond sort of just funding for ECI, there always is legislation that is brought up kind of about the needs of children with disabilities, particularly with regard to ECI. And so I just mentioned a couple of them and I'll go over them real quick. HB 168 by Mary Gonzalez. It's what we've been calling the Comprehensive Child Care Bill. And it encourages childcare providers to promote inclusive practices for children with disabilities, really making it, integrating kids with disabilities into everyday life at a childcare. I have a 2-year-old, and I couldn't imagine having, a place, or sending them to a school rather, where they were isolating kids from one another based on their cognitive abilities. Like, that's ridiculous. And so this bill really does address that to make sure that kids with disabilities have the same opportunities as kids without disabilities that are in childcare together. So beyond, sort of just integrating kids with disabilities into daily activities, the legislation also requires kind of some more systemic changes. It requires that childcare facilities allow ECI providers to provide services on site, which is very important. You want to be able to provide services where your kids are. And if your kid's at daycare, then they really need to be able to have their ECI provider there to help them with the services. It also requires that teachers go through additional training related to disability, which is always important, especially when you're dealing with young children. Disabilities manifest much differently when you're very young, when you're, versus when you get older, and the teachers are not necessarily trained well enough to understand what those differences are. And then it also requires childcare providers to provide parents with information on how to actually enroll in ECI. There are issues with ECI enrollment, making sure that parents even know ECI is there and available to them. And so with the childcare providers being aware of that, they're being able to actually give parents that information will be super fortuitous in helping parents understand that these ECI services do exist for their kids. Okay, I'm going to turn it over real quick to Chris, and he is going to go over slide number 8, which is about telehealth.
Tanya, I'm going to cancel your spotlight video, or did you? Let's see.
Chris, you're on mute, bud.
I keep hitting my internal mute. We have 4 dogs here, so that's going to happen sometimes. So I'm going to talk about telehealth, and just to looking at some of the comments on Facebook, all the stuff we're talking about today is Texas Legislature. So we're not talking about any of our federal work that we work with the national group, the Autism Society of America. This is really focused on Texas Legislature work. And it's great to see all the different people from different places. And again, we'll write your questions in the Facebook area. See that somebody's already mentioned telehealth. So let's go to that. And that is on slide number 8. I don't know that any particular one issue can be uh, more important during COVID, but I can certainly say from the standpoint of having a kid in virtual school and doing virtual therapies, making sure that we have access to those therapies in whether it's private insurance or not, if it's in another opportunity, whether it's Medicaid or anything, these being able to get your kid therapies and maintain those therapies through a computer is absolutely crucial. It has been for us, although my son doesn't respond to some of those, the ones that he does respond to are really important to us. So I think telehealth, telemedicine, what's the other word? They use another one, technology related healthcare services. Texas uses all three for whatever reason. It's an elevated conversation. And so what we've been doing, and frustratingly, is that the governor and the Department of Insurance has been extending reimbursements and forcing private companies actually, but extending reimbursements for state programs and just month by month so that we maintain our healthcare coverage. But almost every month, your provider might not know if they're going to get paid until the very last day of the month when the governor or the Department of Insurance extends it. And so we're very fortunate that Representative Price with HB 974 has introduced a bill that will make all kinds of telemedicine the law of the land. It's a good bill. It's one that seems to be rising. There are other telehealth bills, not to say that there aren't, and those aren't good. It's just that he's in a position of strength as a rural representative, as well as having senior status at the legislature. And so we're expecting that will be the bill that's the vehicle to expand telemedicine, telehealth, or whatever we want to call it, throughout the state of Texas as the way to do business. Now, the important thing is that it's there, but however, I guess that there's always a but, right? Unfortunately, ABA is not listed in the set of early childhood intervention services. Now, when we first started making the exemptions through TDI and through the governor, they actually added in ABA to these early childhood services. And those are things like speech and occupational therapy, the things that we're used to. So we're lucky that two different representatives, Representative Lopez and Representative Johnson, both filed bills that have the language that add ABA into these early childhood services so that when telemedicine becomes the law of the land, we can have that opportunity to make sure that ABA is covered. We are asking currently for Representative Price to put that language into his bill, but we'll also be watching these others to very carefully to make sure that we can maintain those and keep moving on. We feel they're very important, and we feel they'll do a lot for us in the future, because the reality is with COVID, it just highlights how many people in the rural areas are doing without services. So I want to turn it over to Tanya now to talk about another issue that is paired up with this, which is broadband service. I think I have given you the spotlight, Tanya, and removed me.
Cool. Okay, thanks, Chris. Just for reference, let me figure out the slide number.
It is slide number 9. Yes, ma'am.
Okay. So I'm just going to really briefly touch on broadband. Telehealth is not the only reason broadband is a concern. This has been an issue, as long as broadband's been around. Texas is huge, and a lot of it is rural. And so obviously, it's like when you go somewhere and your cell phone's not great, just think about if you live there and your service is never any good. So, you can't, how are you expected to get any sort of telehealth services if you don't have internet? And this is something I actually worked on in a previous position when I worked with rural areas. We were just working with people in Bastrop. So they're not far away at all. They're like 45 minutes outside of Austin, and they have concerns with reliable broadband. So I can't even imagine what it's like in, even more rural areas. And those are the areas that really struggle the most right now because they have the fewest providers, and they have kind of the most narrow provider pool. So if you're trying to find a specialist for your child with autism, it's going to be really tough. So you're going to need to have robust broadband to make sure that you can get telehealth at home. And telehealth is not just for broadband isn't just important for telehealth. It's important for things like homeschool and getting sped services at home. Really, the pandemic has brought out the importance of telehealth in general. So it's really important that Texans have access to good internet so that they can get to it. So one bill that has been put forth so far this session is by King. It's HB 425, and it has to do with the use of something called the Universal Service Fund for the provision of broadband services. I'm not going to get too much into it because it has a lot to do with like utility districts and things like that, and that's real murky. But at a very high level, it's pretty much just allowing for funding mechanisms to be put in place that kind of already exist for local telephone companies, so that broadband companies can get in on the same action. And so interested broadband companies can provide internet in these areas where we really need them to. So that's pretty much the gist of that bill. And I'll spare you guys utilities talk. Okay, and then I'm going to continue on to the next slide, number 10, about Medicaid expansion. So this again is something that isn't terribly new. Texans, like advocates for healthcare, have been advocating for the expansion of Medicaid since the Affordable Care Act was developed, and that was in 2010. That's when we got the Affordable Care Act, and that's how long we've been asking people to expand Medicaid in Texas. The Affordable Care Act ended up, as you know, there are subsidies for insurance through the Affordable Care Act, but they only go so far, because part of the intent for the bill was to expand Medicaid to really help people kind of in the lower bracket of those making lower income be able to afford health insurance without needing the I guess the funding subsidies that are available for those kind of higher up. The whole point was that they wouldn't have to set aside as much money for helping people with subsidies, because they would be able to encourage the states to expand Medicaid, and that system would already be there, and we'd be able to allow more people to have insurance coverage. So expanding Medicaid has been something that's been pushed for a long time. Again, it may or may not, get traction this year. One never knows, but it's important, obviously, because it improves healthcare outcomes for people because they have insurance and then they can go to the doctor. And it also actually creates a lot of jobs in the healthcare sector, which is important to think about right now when our economy is really struggling during the pandemic. So there's a coalition that we work with called Cover Texas Now, and they're a big group of advocates really from across the spectrum that come together to advocate on behalf of expanding Medicaid. And you can click on that link there to see more about that coalition if you'd like to. And what happened this year and what happened kind of in a lot of kind of previous sessions is that a lot of Medicaid expansion bills will be filed, and a lot of them will look very similar. And so kind of our view of that is that we're just gonna kind of hang back a sec and see which ones kind of gain the most traction, which ones we can help with the most, and then we'll eventually be sure to support whatever bill comes to the top. And finally, I included an article, a link to an article on this page that really just boils down Medicaid expansion, what it looks like right now, kind of in light of COVID. And so if you'd like more information, by all means, please look at that article by Dr. Pearman. And I am going to bump it over. Jackie, is this you?
It's me next. Yep. Do you want me to cancel your spotlight video? I'm going to cancel and spotlight myself. Okay, here we go. Wow, we are getting to be masters of this. Okay, so thanks, Tanya. I'm gonna just chat with everybody about autism insurance coverage, which I know is another big issue for everyone. And just to be clear, we wanted to just talk with you guys. So we did provide the PowerPoint. The link is in the comments and it's on our website. So if you're someone that likes to follow along with a PowerPoint, there is one to go along with this. So we know the slideshow isn't viewing right now. We just kind of wanted to chat about what's going on. You can see our faces. It's fantastic. So anyway, the slide though for autism insurance is slide 11 and 12. I'm just going to make sure that's correct. Yeah, so slides 11 and 12 if you're following along with the slides. So we would like to do, we're really kind of recommending some changes to a couple of bills because we really believe qualifying for ABA is a mental health parity issue. Mental health parity is a federal law. I'm going to have to read this. I don't have this memorized. But it's a federal law that generally prevents group health plans and health insurance issuers that provide mental health or substance use disorder benefits from imposing less favorable benefit limitations on those benefits that are on medical or surgical benefits. And so as many as you know, even, when my son was younger, there's limits, like you can go to speech 20 times, or you can go to OT. We always get a lot of, it's like, oh, if you have this diagnosis, you can do this. And if, we get that a lot in the autism world, and a lot of those things have changed over the years. But there's still different things with autism, a lot, more so than other things. So the amendments we are, thinking that need to be done, our previous legislation, it's HB 451 from 2009 and SB 1484 from 2013. And these bills have been going for a few sessions now, and we've changed age limit caps, we've done different things, but, we're still seeing some need for improvement and expansion of coverage. And one of the first things we would recommend is changing the age of autism diagnosis that's used to qualify for benefits. Right now, the age used, you must be diagnosed before age 10. And of course, insurance companies can opt to give you these benefits, and some do the right thing and do it, but they don't have to. It's really just, do you have a diagnosis before age 10? And I can tell you from information and referrals that we get a lot of like misdiagnosis, late diagnosis, especially of women and girls. And sometimes, they're boys that, are just missed or misdiagnosed. And so we think this is really important. And the thing is, this also, we would like to see the age change to 26. So you just need an autism diagnosis before age 26 to cover, for you to be eligible to have autism insurance benefits. And that really conforms with the rest of all the intellectual and developmental disabilities. 26 is the age that is used, and really it should be no different from autism. It's it's something that's going to be with you. The other next amendment that we'd like to propose is eliminating the yearly cap of $36,000 currently in place for those 10 and older. Again, there's not other, cancer doesn't have caps, like not comparing autism to cancer, but, you should be able to get therapy as needed. It shouldn't just have a stop. You don't like stop needing to acquire skills or stop needing to learn communication. So all those different things. So we would like to eliminate that dollar cap for those 10 and older. And then the last thing is, we would like to ensure that healthcare plans cannot require reevaluations more than every 10 years after the initial autism diagnosis. And this is a new thing, but you guys may have noticed some, depending on your insurance. If you're somebody that has insurance and has ABA, you may be asked to jump through a lot of hoops, like prove your child still has autism, prove they still need ABA, get them reevaluated really frequently, like they outgrew it over the last 2 years. And so that's been really, really frustrating and expensive and difficult for parents. And so we're proposing that 10-year rule because of that. And that is the end of our amendments. And we are going to now talk about another important topic, and that is special education. And Chris is going to lead us off with special education. So I'll cancel my spotlight video. And Chris, let me see if I can make you the spotlight. Oh, I did. Okay, Chris, you're on.
Thank you. Thank you. Yeah, as Jackie was saying, I mean, we're thinking about the autism insurance bill, and it does seem to be that there's one particular plan and specifically that has decided to do this, and we want to make sure the rest of them don't follow suit. So y'all let us know, email us and let us know if you're having issues with your insurance. We'll be much more active with the Department of Insurance in this next year, out of necessity, not necessarily because we want to. So yeah, please let us know. This has come up. We want to fix it. I think we have an opportunity to do so. We've talked about parity a little bit already. So let's move on to special ed, and that is begins on slide 13. We're going to just cover a few bills because most of y'all know that I've worked in SPED for a long time, as have others. And there are 100 bills that we're tracking right now, and the session has just started. And 100 bills on special ed are that certainly revolve around school districts or how they work and what they do. And we wanted to highlight, I think 4 or 5 here that we've got that have been consistent, have been important to us, and we think are really important to the autism community in particular. And I'll start off with HB 411, and this is a personal interest of mine as well as professionally. The ridiculousness of calling an IEP team meeting, which is what the federal IDA law calls it, but to call it an ARD meeting in Texas, an ARD meeting. What does that mean? Admission, review, and dismissal. It's an anachronism from a time long ago, and Texas kept it instead of using the IEP team nomiker like they did in most other states. There's only a couple states that still use ARD. We want to get rid of it. We were probably pretty close to passing it last year. I think it was important, and we think it's important to build trust, to create a team atmosphere instead of this technical term that's just way out of date. So we'll be supporting Representative Johnson in doing that. HB 411. We found out a lot of things about behavior and behavior interventions when it was coming, some of the topics were coming up about school safety. And one of the things that we found out, and this certainly happened to me, is that my son's behavior intervention plan at fourth grade was still the same plan that he had in kindergarten. And I've told this story, the staff will probably roll their eyes again, but my son, one of his interventions on his behavior on his BIP was to give him back rubs when he was upset. And while that was appropriate in kindergarten, it wasn't appropriate at all for a fifth grader. And so what we want to do with this bill, HB 785 from Dr. Allen, is to update those plans more often, to make sure that the staff are looking at them, and that any time there is a need for an intervention, that the BIP is updated. And so those are two bills that didn't make it last session. We're still interested in. We're interested in some other behavior bills, which Jackie will talk about. But one of the ones that I really want to stress here, and this will be a big push for us. And remember how I talked about the budget. If you're not working on the budget and you have a bill and you didn't allow for that budget to pay for the bill, then the actual activity, much like we've seen with the autism Medicaid benefit, is up to the agency, and it's up to the agency to fund out of their current budget. So we want to make sure that doesn't happen. And we've called this COVID remediation. You could call it compensatory services for those that are familiar with that term at school. I like COVID remediation because the school districts freak out a little bit about comp ed, compensatory services. But we've got two great champions for kids with disabilities, and Representative Mary Gonzalez, again, a doctor, new doctor, Representative Dr. Mary Gonzalez, and Jose Menendez in the Senate. That's HB 144 and SB 89. And essentially, this is making sure that the schools write a written statement, look at what the child has done in the last year. Again, it's a COVID-related bill, and to make sure that if they need comp ed services, that they get them. And so there will be money involved, and there will be a process and a procedure for the schools, not just to say, well, we think we did the best we could. So even though your child didn't get speech for 6 months out of the year, there's nothing to see here and move along. We want them to put that in writing as to what your child missed and what they need, and to fund it. So this is a very important bill to many of us. And I think it's going to be one of those ones that we spend an awful lot of time advocating for. So let me go on to the next page, and I'm going to switch over to Jackie again.
Okay, I got it. I canceled.
You already got it. Thank you all for sticking with us while we learn how to use this new system and putting up with us. This is new to us. We've never switched off like this trying to do a presentation because it's kind of hard. Thank you.
We're doing okay. So, all right. Our next bills, I'm going to continue on with special education bills. If you're looking at the slides, we're on slide 14 now. And the first ones are teacher training bills. And we all know that makes a huge impact to your students' special education experience. The first one, and there may be more of these, and you can look on our website, but the two we just kind of wanted to highlight is HB 159 and SB 180. And those are the companion bills. So this improves training and staff development for primary and secondary educators to enable them to more effectively serve all students. And there's a lot in this bill. If you're looking at the PowerPoint, you can click through and read the entire bill language, but it really focuses on having the teachers learn about each disability category and how it impacts learning and development, and then how they can best accommodate and prepare lessons to accommodate those, different teaching strategies, different ways to present material. It also has collaborative teaching instruction, like co-teaching. It has a line about having high expectations for special ed students. So it's sort of like the dream special ed bill, in my opinion. So go read all that, because it's all really great and it's way too much to talk about right now. And then the other one we wanted to highlight was SB 193, filed by Senator Powell. And this would require an audit by the Texas Education Agency at least once every 4 years of public school professional development training requirements. So we think that would be good to look at as well. What are the problems? Is this training relevant? What do they really need? What are we missing? And so, we think that's really important. There's a couple of pending special education bills that have been around from last year as well. And if you were at our Autism Advocacy Day, the first one was early pickups, and pretty much half the ballroom, or what is that called? The auditorium room at the Capitol. I mean, half the people jumped out of their chair, because a lot of parents who have children with autism have experienced this. Their child isn't doing something right or whatever it is, and the school calls and says, come get your kid. Well, this bill would actually mean schools are prohibited from releasing students before the end of the instructional day as a disciplinary management technique, or for a behavior that is impacting the kid's ability to learn. So if they're just up or they're fidgeting or whatever, you can't just call and say, no, come pick them up. It's not a behavior management. So this puts an end to that. In the past, there was some things about creating a PEMS code and more documentation, but this bill is a little simplified, and it literally just prohibits schools from releasing your child before the end of the instructional day. And it'll be under like a compulsory attendance section this time as well. So that should help. The second bill we're supporting when it's filed will be it's about the 9.62 penal code. And it's a bill about use of force. And this bill revises the penal code to state that use of force against a student is only permitted by a teacher when it's to maintain the safety of the student, other students, or staff. It is not an acceptable form of discipline. It also states aversive or not justified use of force, and use of force should not deprive a student of a basic need. This bill is going to be filed soon. So essentially it's, you can only use force, like is a child running out in the street? Are they in imminent danger? Those kind of things. This is very, very limited and very specific on when use of force can be used. And this bill is actually going to be filed soon. We're also monitoring, there are a number of other topics of special ed bills that we'll be looking at as well. And that'll be looking at the cost of special education. Of course, we always are going to be for more funding, alternatives for graduation, transition, adaptive sports and UIL, assessments and evaluations, and quite a few bills that are focused on charter schools and just making sure that kids aren't being discriminated against or being excluded in some way. So for students with disabilities, they're not being somehow adversely affected by these charter schools. And then that is all of our special ed information. Chris, I'm going to cancel my spotlight video, and then Chris is going to do, and Chris, I'll highlight you, and Chris is going to talk about vouchers now. Chris, you're on spotlight.
Great, thank you. Thank you, Jackie. So this is slide 15. And so what I wanted to do, and this has been an issue that keeps coming up, and I personally feel like that parents and myself being one, we're fed up with some of the issues that we see at our public school system. We're fed up with struggling and fighting, and I'm concerned, and all of us are concerned that folks are going to reach out for whatever they feel is a lifeline and make some decisions that may not be in their child's best interest. And I'll be honest, every session I get upset and tired of us filing bills to fix special ed, filing bills that to be really honest, TEA should have already taken that suggestion and implemented. That the school system should have said, hey, we're listening to you parents, let's fix some of these things. And so I know it's frustrating. It's frustrating to me to have 50 or 60 options to fix things and to have certain folks in the legislature only be offering what can only really be a small amount of money for our kids and our families just to go away and leave them alone. And so what we wanted to do and what we think we needed to do was to let people know that there are going to be vouchers and voucher-like bills out there. There's one already filed. I don't want to talk about it. It's not very good. But we're going to be watching those. And again, we want to stress the things that vouchers don't do for people, because we are concerned that folks are looking for a lifeline and will take anything they can get. And so number one, and I'm going to go through these. I haven't been going through the slides. And again, slide 15, private schools don't take children with disabilities in a lot of cases. And when they do, the voucher is only going to cover a tiny fraction of the cost of that. No transportation. And for me, one of the most difficult things to ever consider to make the choice to give up my son's IDA rights, these rights that obviously we fought so hard for, that didn't exist when I was born. If my son was born when I was born, he wouldn't have been able to go to school before kindergarten in every location in every place in the United States. IDA lets our kids do that and lets them go with rights and responsibilities for the school district, for the state. And I know they don't live up to those all the time, but when you take a voucher, you're giving those up. So what we want to do and what we want to stress for everyone and hope they understand is we want to focus on these real, measurable, good solutions to fix SPED, like the comp ed bills we talked about, like the teacher training bills, all the things that we talk about our schools do. We would love to see those implemented. And we know that if someone chooses a voucher and leaves a school district, in all likelihood, those things won't happen for them there, or even a charter school in some cases don't have the resources. So what we're hoping is that if we can spend some time with these comp ed bills, if we can spend some time discussing extended school years, if we can talk about targeted interventions, all these things that could help our kids deal with the COVID slide or the blip or whatever you want to call it, that's much more useful and more thoughtful and more helpful than us supporting or being interested in many of these voucher bills, which will just take all the responsibility away from the entities that are supposed to be providing for our children away. And let me see what's next. That's all I got to say about vouchers. And so we're going to switch over to another issue that I got to say, I'm always just disappointed that some of these things, most of these bills that were filed early, guess what? They were filed last session, and some of them were filed the session before that. And this is a perfect example. So I'm going to remove my spotlight and switch over to Jordan because he has intimate knowledge of these bills, and let you take it away, brother.
Yeah, hello everyone. So happy you could join us this evening. So I'm Jordan Fogel, the projects coordinator here at AST, and I'll be covering slide number 16 if you're following along. There are roughly a dozen bills, probably more related to public school safety and the staffing of social workers and school counselors and nurses, and I'll just be going through a short list of the bills we'll be advocating for. So HB 28, filed by Niave. HB 226 is the duplicate from Bernal, SB 253 from Menendez. So relating to social work services in public schools, the bill refines the definition of social work services in statute, and it specifies social workers' core job duties, as well as the educational context in which their services may be offered. We have another priority for us is HB 589 from Gonzalez. The companion is SB 179. This bill aims to codify what activities do and don't constitute counseling. So it mandates that 80% of a counselor's total work time be spent on activities related to a school's counseling program. For example, I've heard a frustration expressed over this. Administering assessment instruments doesn't count as counseling, but interpreting data from relevant assessment instruments does. So this bill also outlines certain justifications for schools that fall below this 80% threshold, such as understaffing, as well as some associated reporting procedures and compliance measures. So just a couple other bills we'll be following and supporting. HB 287 from Gonzalez. This bill states that districts with 250 or more students in elementary level grades shall employ a certified counselor for each elementary school in the district. It also lays out some kind of guidance and counseling services, or lays out requirements for providing guidance in districts where there are less than 250 elementary school students. Another one that's near and dear to my heart is HB 181. This bill mandates that every school shall employ a full-time nurse, and that there be a ratio of one full-time nurse for every 750 students. I testified personally for this bill, or a related bill, which was HB 1847 back in the 85th legislature. And its companion, SB 196, after it was passed in both chambers, was vetoed by the governor, and he called it a needless regulatory mandate on schools. And we're thinking with the additional pandemic-inspired support, that the effort to get full-time nurses on campuses, this will gain more traction, far more traction this time around. So SB 78, yep, just quickly to wrap up, this bill requires that all public schools, including open enrollment charter schools, provide a notification. So that's actually just a refile of that bill I had previously testified for. So important stuff. And with that, I'll hand it over to Jackie for law enforcement interactions and first responder training. Yep.
Great, thank you. I will put myself on spotlight. All right, thanks, Jordan. Okay, yeah, so as Jordan said, I'm going to talk about law enforcement interactions and first responder training. And obviously that's been in the news and very at the forefront of things. We actually, we actually had a grandmother, an African-American grandmother, call our information referrals line and ask how can she protect her autistic son, her grandson. Which just thinking about that makes me upset, but that's the situation we're in right now. And it's not something that's new to Autism Society. We have been working on first responder training for quite a few years now. We provided first responder training around Texas. We've also worked at legislation at the federal level and supported legislation at the state level. But we are looking right now, we're basically kind of monitoring what's going on, and we're hoping there's going to be a really good opportunity with all the bills that are being filed. There's been, quite a few bills filed targeting appropriate interactions between law enforcement and civilians. And we'll just be looking at those bills and seeing what's the best vehicle for, to get some training in or some language about people with disabilities, people with autism, and a little bit more mandated training. So at the moment, we don't have a specific bill, but we will be looking at that. And then we'll be continuing our efforts I know we're not going to talk about federal too much, but we did work on Kevin and Avante's law quite a bit, and there's funding in that to do first responder training. And so that will be coming down the pipeline through Autism Society of America and into the statewide affiliates like ourselves. So that is something will be kind of coming up in the future. And with that, I'm going to turn it over workforce development. And now I've forgotten who's doing workforce development.
That's mine.
Right, let me unmute myself. Okay, Chris, I'm going to cancel my spotlight then and put it on you. There we go. I think you're good.
So I want y'all to know that, we work on a lot of issues and this is not even all of them. We chose some of our highlights. And so one of the ones that I've been working on for several years, as a member of the Policy Council for Children and Families, which is an advocacy advisory committee, at the Health and Human Services Commission, was we wanted to figure out why folks weren't using the Medicaid buy-in program and the Ticket to Work programs. I suspect that, out of the 40 or 50 people who are watching right now and the 600, almost 700 who've tuned in at some time tonight or have clicked or looked at it, that most of you don't know what Medicaid buy-in is. And that's a shame. because what it really allows is for working people, adults and families, to essentially buy into Medicaid when they can't afford insurance and or they're working and their own insurance their own employer doesn't give them insurance. And so in looking at this over the past few years, what we've realized is that the program has some restrictions. Imagine that. Here we are in Texas, and they found some restrictions. And the restrictions limit how much money you can make if you're an adult, how many resources, how much money you have, what's your savings. And for children, it limits folks by their income, and it's a lot. So essentially how the program works is you can qualify if you're a working adult and there's a certain amount of the poverty level. So what we've chosen is to increase that rate to the federal maximum and to get rid of these resource limits. We all know that resource limits on Social Security, on Medicaid, on almost any other needs-based program really hampers people. And guess what? They haven't been changed since the mid-70s, not late 70s, mid-70s. And so in this case, we feel like that this particular program could really help a lot of people, especially people who are building careers where they're starting to work out in the workforce, but they haven't got a good enough job to have their employer pay for the healthcare coverage, and they're making enough money, but not of course, they don't want to be in poverty and stuck on Medicaid. One of the things that we're also interested in doing is making sure that everyone knows about this program. And so we're going to put this into the Transition Employment Guide, which all children should get when they're in school, all students age 14 on until they graduate, so that families and individuals, students will learn about the program beforehand. And so that's one of the things we're working on. It's one that I wanted to highlight in this particular instance, because I think if we can reach another 40, 50,000 people, whatever it is, and tell them that Medicaid buy-in program exists, then it was worth it just adding it into this section. And next is everyone's favorite topic, medical marijuana. And we're on slide 19. I don't know if y'all know this, but in my former job, was heavily involved in creating and helping to create the compassionate use program, which was focused on kids with intractable epilepsy. Myself and my brother from another mother, Chase Bearden, were in these hearings with these families, and we were lucky enough to pass the law and then to change the law and add in autism. And now what we want to do is give the doctors the ability to prescribe the correct amount at ratios and amount of CBD oil to THC. And if y'all don't know much about the compassionate use program, we've got tons of information. We'll be working on this the whole session, but doctors deserve the right to choose the appropriate amount of medicine. It's that simple, because right now, without any THC, that helps some people, but it doesn't help everyone. And some people need higher amounts in order to be, an adequate medicine for those folks. Right now, the current rules, and I could go into them, but they're just god awful restrictive as to how the medicine's delivered, how you buy it, how you get a prescription. There's all kinds of things that are wrong with it. And so we want to work to get the greatest benefit for everyone out of this program. We're not advocating for, widespread marijuana to be legal and legalized, but we are very concerned that if someone is taking some type of medicinal marijuana with THC through a prescription, that they're also protected from any legal ramifications of that. And that goes for students too. Most school codes of conduct, if they were to test the child, and they can do random testing in some schools for some people, if they were randomly testing a person who had a prescription for some type of medicinal marijuana with THC in it, they could then expel that student. So we're also very concerned with making sure that people that do have valid prescriptions are also protected from the law. So with that, I think we're now at the end of our formal presentation. And we wanted to give you some information. We have our advocacy list. We have brand new out there, a whole bunch of regional Facebook pages that I think all of you that are in. I saw Beaumont listed and a couple other places here in San Antonio and other folks who are all over the state. We want y'all to have regional Facebook pages where you can post events and all kinds of things that are important to your local area instead of just stuff that's statewide. And of course, if you're not subscribed to our newsletter, Jackie does and everyone does a fantastic job on these newsletters. They come out a couple of times a month. We'll be interacting with y'all also on the legislative issues and letting you know what's coming up, when it's coming up, and what the action should be. We hope to have one of those fancy email programs that'll let y'all contact everybody that's in your district, but we may be still at that stage where we're giving you the committee folks' names, their email addresses, and their phone numbers, and telling y'all that we need some phone calls on these particular bills. But the best way to interact with us is to be on this advocacy email. We've got a way now for people to interact in their local regions, and by all means, if you're not getting that newsletter, you should. It's one of the best by far of any of the organizations out there. It's just a fantastic. I subscribed to it before I was even involved with this organization because it was so good. That's everything that we had to present. Jackie's smiling because she, again, does so much of that. We are now, I think, to the question and answer stage, correct, Jackie?
Yes, and I can read out some questions. We're kind of got a group effort going here on these questions because we've got one of our staff members, Leslie, posting them for me, and then I think we might take turns in answering them. And so, Chris, I'm going to cancel your spotlight video, and then maybe we can both answer some stuff. Does that sound okay? And whoever wants to.
That's perfect.
Okay.
We'll do it like a game show that whoever can raise their hand fastest gets to answer the question.
It'll be like,
all right, that'll be fun.
AST member. Okay, so none of the questions are too weird yet. So I'll start because
somebody post some weird questions.
No, so the first question's from Mirama about ABA, and she asked, and this is a great question. She said, the bill that is supposed to have Medicaid cover ABA, how long after that bill passes will Medicaid actually recognize it? And can someone help me understand in the simplest terms, if the bill passed, why, and what does it mean that we are waiting for it to be implemented?
Let me start with that because I want to make it real clear. It's not a bill and it never was. We never had a specific change in statute to allow ABA, an ABA Medicaid benefit. What it was initially a hope that was put into the budget for the Health and Human Services Committee. It was taken out of the budget and put in something called an exceptional item. And then it moved even further down the list to a wish list. And then it ended up in a rider as a directive to HHSC to do that program, but without any funding. And so that program as a directive started, and it started fast-tracked, gangbusters. We really thought, didn't manage expectations maybe as well as we should have with these giant state agencies. And we were moving along. We had opportunity to work on the rules, and it was about to get to the point where we were going to the next stage, and then COVID hit. And everything stopped, and it stopped primarily because of budget reasons. Where we're at now is that they still haven't had a rate hearing. HHSC being they asked a legislative budget board if they could spend money. I haven't heard anything out of that. They didn't have the rate hearing. We have been told the program, at least the program process and procedure for providers will be active in the spring. I wouldn't hold my breath if I were y'all, but we know that our best case scenario is to try to get that benefit put into the budget to maintain that directive that HHSC has to do it, because we've heard through the grapevine that they're dedicated to it. But I'll be really honest. I've been around for a little while, and I've seen lots of commissioners come and go at HHSC. And I've seen the promise of one commissioner not be honored by the next one. And as an advocate for the kids that this program will fit, we need that directive in writing. We need it in writing. We need a dollar amount attached to it. And if nothing else, we need to see that program move forward before we can believe that they're just going to do it out of the kindness of their heart versus legislative advocacy. Did I miss anything, Jackie?
No, I think that was it.
We fought on this issue for so long now. I mean, it's been more than 2 years. It'd probably be 3 by the time, when to ramp up to even getting it there, and then to see all of it kind of just be blocked and everybody be on hold for so long while these kids do it out these services is really just, it's disgusting. It's heart-wrenching. So I hope that answered all the questions. I didn't mean to go on too long, but I wanted everybody to understand where we're at in this process, because we can't let that happen again. We need to hold them accountable. And the only way to do that is with a directive and a rider in the budget, and or to have an actual budget item. I don't know if we'll get there or not in this tough times, but if we have a rider, at least we have directive.
Yep.
Anything else, Jackie?
No, a general question from Michael Oda. He said, will we get a list of bills? And just so everyone knows, all the bills we've discussed so far are in our PowerPoint that we've been referencing, and it's in our website. So if you go to our website, I know they've been putting it in the comments, but it's texasautismsociety.org. If you look under advocacy, there's a section called 87th legislative session. So far, everything that's been filed that we're supporting is listed and linked in our PDF. So you can look at that as a reference, and then we'll be, as things are filed, have been moving a little bit more slowly. And so things are in Leg Council, things still haven't been filed. And so as things are filed and we are supporting the bills, we'll be adding them probably on that 87th legislature page. And then let me see what other questions we have.
Well, and also, what we're talking about tonight is just a small amount of those bills. We usually track hundreds and hundreds of bills. And sometimes a bill will come up in a hearing and we haven't been really talking about it, but it might be something that we can add an amendment to and stuff. So we'll try to make sure that we have a good list of those bills that are priorities and those bills that are moving. The reality is, until they get a hearing, they're not really worth much to anybody. And so that's when they really become valuable. So when we know they're going to get a hearing, that's when we can let everybody know and get those folks to call in to that committee just to start the process off. Yeah.
Mm-hmm.
Next question. Sorry, I wanted to make sure that.
Some of these things are comments, so we do appreciate the comments. We got also a comment on SPED from Michael Oda, and he said, starting to hear at ARDS now that schools can provide a service because it's a medical need and not an educational need, which
don't let me talk about this. I'll get really mad. ECI is a school preparation program. It is not a therapy program. Anybody saying that, the parents should file a complaint immediately. There's no excuse for that.
Yeah, and I think they're saying at the ARD that's happening, but we do see kids like denied services because
they're denied all the time. File a complaint with TEA immediately.
Okay, so that's good advice, guys. File complaints if that's happening. And then let me see what else we have. We have a comment from Linda Litzinger at Texas Parents Parent, and she said, my 2 cents, 2 months seems to be the point of time when private schools kick kids with disabilities out. Yes.
Absolutely. Charter schools too.
Charter schools and private schools. And so when you're seeing, if you saw our little list of voucher concerns and private school concerns, it's because they don't always want to take kids with disabilities or kids with autism. They don't have to. Well, especially private schools don't have to. And so, that's a good point, Linda. 2 months is about the time when everybody realizes it doesn't work. Caroline Turner, thanks, Caroline, said this is helpful and informative. She also asked, how can we get updates and know how we can help? So I think in the comments, or you can go to our website, we are going to have an advocacy alert system. I mean, definitely subscribe to our newsletter, but for immediate advocacy alerts, I would subscribe to our advocacy alert email list. Let me see what else. We will have this up on Facebook. We're going to put it on YouTube. We said thanks for the positive momentum. Thank you, Carrie. Oh yeah, Linda mentioned back to ABA. Linda said, I heard ABA therapists are waiting to see if the rates are good. And Chris, do you want me to comment on that? That is
Sure, go ahead. I mean, they can keep waiting. Nobody gets great Medicaid rates. So no offense, but
yeah.
are they going to be sustainable? That's the issue we'll have and we'll be advocating for. So I agree. Goods relative. Will they be enough to serve the children? And that is the $2 million question or whatever.
Yeah, I was just going to say that's the $1 million question because we know that's been an issue with ECI reimbursement rates in the past. And, so we are waiting on the rates, and that's one of the steps in the very long process to get ABA implemented. So we'll have to see how that works. And then Jolene asked, she's late to log on. That's okay. Did you discuss AST's efforts to address the 3-year re-diagnosis requirement that has emerged over the last couple of years?
I'll take that one. If you had logged on time, yes, you would know that, Jolene. Jolene's one of our partners out there with CTD, wonderful advocate. And so I can make fun of that, but yeah, absolutely.
And Michael answered her. So Michael, thank you, Michael. And I just realized that. So Michael said, yes, we're going to hope to have an amendment that makes it at 10 years. So every 10 years, you would only have to get a re-diagnosis or re-evaluation every 10 years to prove you still have autism.
And I'm sorry, Jackie, to keep interrupting, but that's just how this is supposed to go. I think we chose 10 years as a fairly arbitrary number. If someone has some interval that they feel is really, and Michael Oda or anybody, that they feel is better than 10, we're happy to do that. This bill hasn't and may not get written in time. We're going to try. The main thing is that that's the number we just chose because we felt it was reasonable. 3 years is not reasonable. But 10 years might be reasonable to get the young person evaluated because they change so much. And maybe it is a good time to do that. So we'd be happy to hear from everybody on that number.
Okay, we're getting more questions. And Leslie, thank you. You're doing a great job putting these in our little shared document here. Carrie asked, is there any special groups we could become involved with? I'd be interested in getting more involved with supporting telehealth coverage, becoming more permanently available. We agree, it's been super helpful. I don't know if we're definitely going to be advocating in your walk. We have a whole advocacy training series on our website as well. If anybody missed that, it's very, very comprehensive. We did it in November, but all the videos are on YouTube. Then you can get on our list. And then do you guys have is there any specific people just working on telehealth, or you guys know?
I think every group that I can think of is, I saw NAMI was on here. I know they're interested. CTD's interested.
The ETI Coalition, everyone involved with them is doing it. The Texas Pediatric Society. I think pretty much anybody who's at all interested in healthcare is committed to expanding telehealth.
Yeah, that's what I thought. So, so Carrie asked that question. Carrie, good question. I think, any of the disability groups, everyone's supporting it. And so if you want to get our advocacy alerts, CTD, Texas Parent to Parent, there's a lot of different groups probably that'll be supporting this. The next question is for Chris. There's a couple of Medicaid questions from Veronica. It says, on Medicaid, there's two things. Has there been any notification on budget cuts? And it says, budget cuts that it would impact services through Medicaid.
Not that I know of. The budget hasn't, we don't know what it is. It's at this point in time, everything is just an ask from HHSC. But in general, a lot of these Medicaid programs that are not treated like a block grant are pretty stable. And so, whether or not any of those have changed is usually about the individual being reevaluated or having somebody look at their family and say, well, you don't need these hours or you do need these hours. So I don't think anything will change on the basic level of services, in particular with the waivers and some of the community services through the managed care organizations. But there's always that chance that there will be some budget cuts. Most of these things are not treated like a block grant like ECI, where they squeeze people off of it. They're pretty standard. The Medicaid rates are set by the Center for Medicaid Services. So, and we have a different federal government. We have a major turnover in federal government happening very soon. And I think that would not be something that the new administration would be interested in, is cutting off services or allowing the states to choose to do so. So I at least feel somewhat good about that.
Okay, more questions. Thanks, Chris. Okay, so Caroline mentioned she's always surprised when parents don't know that ECI is available. And she was told that pediatricians are required to tell parents about ECI, but many parents don't know. So that's what she was she was asking about that. Are pediatricians required to tell parents? Why don't they know? Why don't parents know?
The hospitals are too. I mean, they have packets they give to folks. I never understand exactly why, and I would love to delve into that. Tanya, what do you think? I don't know why people don't know, and why the physicians don't know. If it's because the diagnosis doesn't happen at the hospital, or when they first see the pediatricians. I don't know why kids aren't found. It's part of Child Find. Again, ECI is a therapy program. If I guess I'd have to give into that. It is a program where kids get therapy so they're prepared for school. And Child Find responsibilities through IDA, are widespread, from practitioners to hospitals to school districts to everybody. I don't know.
Yeah, I guess, like the legislation that I discussed earlier about daycare. One of the components of that bill is making sure that parents find out. I guess perhaps that's a stopgap for parents who may not be finding out from their physicians, that they can find out from daycare. And I guess it's just like every other healthcare program that we have anywhere. Some people just don't find out about it. And I think ECI does have a lot of mechanisms for parents to find out. But y'all know, as parents of children with disabilities, it can be tough to navigate those systems. And Lord knows you've got other things you're trying to figure out also. So, I don't know that that's an excuse for not telling people about ECI, but those are just my musings of perhaps why people aren't finding out about it as they should.
There's a whole nother issue with parents who decide it's not worth it. They're not getting enough services, and the hours are, even my son Matt is 11. When we got ECI, he was getting a lot more hours, and it was only like 4 a month than some people get. And so and there was a time when people would have to go to somewhere to drop their kid off to get them, or there's some folks that have to go to daycare. And again, as we've said, some daycares won't let a therapist come into their facility, and so we want to change that too. But I really wished I understood why we have a program. The other side, if everybody did know how many people would sign up and how many would get turned away, how would they squish that program where not everybody get qualified? And you know how it is when people are turned away. That's the beginning of the breaking of the trust in the support system that we think is available for us. And when you finally get to the point where you're so frustrated and tired of that, you learn how to do without. It's a sad thing.
Okay. Are we ready for more questions?
Next question. Yes. No sense in me musing about why I don't understand why we don't have a system.
I just don't know about ECI though. Yeah, it's like the greatest.
I know it. It's a good question. Thank you for putting that on there.
Yeah, and really we find sometimes there's a lack of awareness about programs and autism and all kinds of things that we probably should try to do a better job educating doctors about. So, that's a good point. And okay, and then I'm going to say, we're going to go back to ABA. Caroline, who just brought up the ECI topic, mentioned, this is a good point, Caroline, that about the 10 years, re-diagnosing every 10 years. So a lot of the other difficult thing about the reevaluations that are being required right now to prove you still have autism and qualify for ABA is that they also won't let you go to a neurologist. So while you used to be able to go to a neurologist, a pediatric neurologist, and get an evaluation and get a diagnosis, and that would be fine, Now they're saying it has to be, you know, like a developmental pediatrician or some other different professionals, neuropsych evaluation. So those are even more costly and usually months and months long waits. And so one thing that Caroline pointed out is developmental pediatricians are really only see kids up to age 14, and some of them are even younger. Like they stop seeing kids at a younger age than that. So it would actually, like if they got diagnosed at 4, then at 14 they may have nowhere, even less places to go to get reevaluated. So that's a good point and something to consider. And then Michael Oda also pointed out, he said, what other conditions require a re-diagnosis to prove you still have it? He said, I've never heard of ADHD having to be reevaluated. He also said, what's Texaba's position? And we'll need to get with them. But Chris, what do you think about this? Nobody else requires a reevaluation. Is that correct?
People do get reevaluated through managed care on a fairly consistent basis for lots of things, but it's usually not for the diagnosis, but it can be. But it's usually for the amount of services that they get. I do know that there have been kids who it may be, and I know a particular case where a child has Down syndrome and had some other behavior issues, and they reevaluated and took some services away for some co-occurring conditions. So that's a good question. I think it's discriminatory. I think that's what your question was getting at. And what was the second part of that question?
About Texaba.
Texaba, we talk with them, and we have talked with them a lot. They're specifically their lobbyist. And in fact, we were talking today about the issue, and certainly it seems that, and this is just anecdotal, it seems the Texas Department of Insurance is much more interested in talking to us about issues and things that they feel providers are getting away with. When providers are doing something different, they seem to be somewhat active in trying to make sure that they're policing them. And so I will say, and not to say too much because I don't think I should at this point, they're listening to us. And that's shocking sometimes as an advocate, but we may be able to talk with them and get them to stop this behavior. If it is indeed, and that's why we need to hear from y'all, if it's indeed every 3 years from one particular healthcare company, we need to know that. I'm not going to tell you who it is. That way we can see if it's all the same. Because if it's all the same, then they're doing something no one else is. And I think TDI is interested in stopping that. And again, I was talking with Texaba's lobbyists, so we're all working towards the same goal. I don't think anybody's brought up the re-eval thing as far as a policy position. We're really seeing it as a breakdown in the responsibility and accountability rules at the Department of Insurance. So we're not really working on a bill, except for the fact that we're probably working on a bill with some language just saying that you can't do that. And we may have to pull that out because sometimes these rules that they want to enforce, the agency will fight for that not to be in statute because it's already in their rulemaking authority. So, which is easier to change. Good question.
All right. Another comment on ABA from Jolene, and she said, another thing to consider in regards to ABA Medicaid is reimbursement for translation and interpretation for families. Without reimbursement for this service, providers may opt to not accept Medicaid because it's costly, which would shrink the provider pool.
True that. I don't know what to say about that other than that's a fact.
Yeah.
I don't think we have anything in the works to deal with that. Maybe other organizations do. We, of course, would be happy to make sure that we're supportive of that. I know we've talked about it in the past, Jolene. I hadn't thought about it. I don't think we have anything pending in our unwritten or unfiled bill packet to address that.
Mm-hmm. Okay. All right. And then don't think we have, let me just refresh. I don't think we have too many more questions. We do have a comment from Lauren. Thanks, Lauren. She was talking about referring to the ECI comment. She said it might be that providers are required to refer the child to ECI, and then ECI maybe fails to get in touch with the parent, and the doctor doesn't tell the parent directly. She said that's my understanding of the process, at least from her work with newborns. So
That's possible. Yeah.
yeah, but I think it should probably be a blanket thing. Like when somebody calls or you talk to your pediatrician about autism, they should like refer you or delays, developmental delays or speech. A lot of people see speech delays. They should probably be referring you to ECI if your child is under 3, like immediately.
Well, and I could see, parents getting a doctor saying you really should look into this, and some parents don't want to until later on they're convinced that they have to or need to. And I could see that happening also. And then, it is only to age 3. And so some people might miss that window. I know a person that missed that window because they were being very stubborn about their child's development.
Yeah, that happens too. Definitely with autism, that people definitely miss that window, or they catch it around 2.5, or by the time you wait and get in, it's like you're on the brink, or you get ECI for a pretty short time. But it often is the first place. If you're under 3, it is often the first place people go. And then I think okay, yeah. So Texaba in the comments, Ronnie, thank you. Commented Texaba commented on the 3-year reevaluation recommendation. They feel it's prohibitive and inappropriate. Yes, absolutely, we agree. Let's see. Okay, and I think that's really all. I think we'll post, there's some things about, what are Texaba's positions, so we can link to that. But we are working closely with Texaba. We know people on there, some of the officers, and we're working with their lobbyists. So we're definitely working with them closely. So let's see. And I think that we're pretty much done.
Well,
okay.
Before we go, let me do some shout outs. The Austin Community Network in San Antonio, thank y'all for being here tonight. We appreciate everything you do and all your support. The folks are our chapter folks, so the Autism Society chapter in El Paso. I saw that some of them were on here. Thank y'all for being, I know you've got an extra hour, so it's only 8 for y'all, but nonetheless, I know we appreciate y'all being there. I see some people again from the illustrious Coalition of Texans with Disabilities. Linda from our wonderful partners there. Scott, I see Scott Fassard. Thank you, Scott. Ronnie, I see you. I didn't see you earlier. Thank you. Caroline, thank you for all the questions and the wonderful support that we're getting from you as an expert on many of these issues. Your questions and thoughts in this chat have been very helpful to keep the conversation going. I see the Solanantes are here, at least one of them. Maybe the other one's watching too, so I won't say anything else. Who else is here? There's a bunch of people. And again, thank y'all so much for coming. I hope that there was some useful stuff for you. I hope that this was just gives you a little teaser into all the work that we're doing, because it is not even probably a quarter or a tenth of what we're doing on the bills that we're following. And we're going to be as active as active as the legislature is going to let us this session. While they're on their next 10-day break, we'll try to get a little ahead of the game if we can and start working on those budget items. Jackie, anything you want to say?
No, I don't know if we want to end. I have a screen. I think it's in the comments, but some of the stuff we've been telling you guys, actually, I might does anybody else want to add anything? And I'll share this final screen and then we'll wrap up. Any other comments, Tanya, Jordan, Chris?
No, I just appreciate y'all taking your time out tonight to hear about what we're doing. It'll be all there up on Facebook and then eventually YouTube, and saved. You can go back and laugh at how silly we are changing the spotlights back and forth.
All right, I'm going to share my screen now. And it's not. Hold on, let me maximize this. So this is our. I think we're all on. I'm not sure. Let me move my. I hope everyone can see this, but we've got our advocacy email list, which is tinyurl.com AST advocacy. We've got our regional Facebook groups that are all, you can go to our website and join those. And then we'll also be posting advocacy alerts, and we really would love for y'all to join those groups and invite people, because sometimes if a certain person's on a committee or your person filed that bill, or so there might be a reason we need somebody from Lubbock to call somebody or whatever the situation may be. So we might be posting regional alerts in those groups as well. So please join our groups. And then subscribe to our newsletter. And you can always check under advocacy. We have a section 87th Legislature. So, and we put 2021 just for those who are not sure what that is. We put the year as well. But, please follow us, we really appreciate your support and watching us tonight. And I think with that, we'll conclude. Y'all can always email us with comments and questions. We're happy to answer questions anytime and help you with autism related things. So I think that's it. Thanks for joining us. And with that, I'm going to go ahead and stop sharing my screen. And I think we're going to wrap this up. All right, I'm going to hit end.
Bye, everyone.
Cancel
Thank you.
live Facebook.
Thank you so
Thanks
much.
all. Appreciate you all being here.